is Franchesca Sanchez. I am 32 years old. I'm a licensed professional counselor, and I also am an educator on the side. InterX. So I met Janice when we started going to a church, and we met her at our community group. And she mentioned a little bit of what she did. Back then, this was probably 2.5 years ago. My husband and I were struggling with health issues, or basically a lot of pain in our neck and our back. And she kind of talked a little bit about InterX, but we were kind of skeptical, like a lot of people are. Mm-hmm. She mentioned it was physical therapy with some electric stimulation. Basically, that's my understanding of it. But we decided to keep going the traditional medical route with a lot of prescription and injections. We did some physical therapy, but it was very different from what InterX is all about. Probably a year after our neighbor, she had knee surgery, and she didn't recover very well. She could barely walk. She was in a lot of pain. She had other complications after the surgery, and she's an elderly lady. And probably a month after I saw her the first time, she was walking. She didn't look like she was in pain. She wasn't struggling, and I just immediately went to her, and I'm like, what happened? And she's like, well, you know Janice, right? And I'm like, yes, I'm in her community group. I know Janice. And she's like, well, I went to see her. And I started treatment, and I'm off most of my medication. I'm able to do my stuff. And I'm like, no, it's not possible. And she's like, it is. So I would say that was probably last year around September. And I called Janice, and that's how we started our treatment here at InterX Therapy.
So I guess you kind of described some of the obstacles that would have prevented you from trying it eventually, because most people do. They have obstacles in the beginning. So I guess tell me about like what was going on specifically with you, and what did you try before, and kind of what's finally brought you here.
So I've always struggled with migraines, basically. Turns out that I dealt with a lot of stress, and I was so used to being basically an adrenaline junkie that I didn't realize how bad my body was after the fact. So a lot of migraines, a lot of tension in the neck and shoulder area. Treatment before, probably like 10 years ago, was like sometimes Valium for a week with injections straight into the areas where I was affected, muscle relaxers, anti-inflammatory medication, pain medication. Nothing as severe as opioids that came probably after, maybe 2 years ago. But nothing really worked. So I just got used to the pain, and when it got really bad, that's when I would start medication again and kept going. With that, your sleeping always gets kind of worked up because you're in pain, and if you have stress, you can't really sleep very well. And I guess that was fairly the treatment. And when we moved here to Texas 5 years ago, my husband started getting treatment on his back, and I met with his doctor, and I mentioned that I had back problems, and he's like, well, we should start treatment. And at that point, probably 4 years ago, it was just a lot of inflammation in the neck area, sciatica problems in the lower back. We did a lot of injections. We did a lot of nerve blocks, a lot of rhizotomies, where basically they just burn the outer layer of the nerve, so you kind of register pain differently. And that's when we started using opioids. I've never been a prescription person, and thankfully it did not get to the point where I got addicted to it. but it was not a way of living. Like, I would wait until the pain was so bad to actually take my medication, because again, it was opioids. I'm a professional counselor. I know what that does to you in the long run. But it got to a point where, you know, at least the muscle relaxer and the anti-inflammatory, it was a daily thing. And at first it worked great. Sadly, my genes have the tendency to getting used to medication real quickly, so I had to play with the dosage, or after a while it wouldn't work. That first year of treatment was great, I won't lie. It really helped. I barely got headaches. Inflammation in the neck wasn't really that bad. But again, my body got used to it. And injections that would last weeks now just lasted 48 to 24 hours. And a lot of chiropractor work was done. At that point, I didn't know I had something called EDS, which chiropractor work is not recommended because it just makes your joints a lot more hypermobile than what they really are. And with that condition, you have pain mostly in a lot of areas, especially neck and shoulder area. And this I recently found out a year ago with another condition called POTS, which is basically a postural tachycardia syndrome that causes a lot of fatigue. So for years I struggled with not knowing why I always was so tired and feeling like I was 80 instead of 30s or 20s. But I thought, well, I do a lot of stress related activities. I was a teacher at some point. I studied, I completed 2 masters. So, you know, I thought, well, of course you're probably have a backlog of a lot of tiredness and sleepless nights. So, you know, I just kept going. And when they finally found that I had POTS, it was actually about the same time that I started coming to InterX therapy. Nothing was working at that point. I probably took 5 different medications, wasn't sleeping. I also struggled with depression and anxiety, so that was up the charts. I was seeing 8 clients per day in a very stressful environment. So I don't know, I don't have words to describe where I was. It's just now that I've gone through therapy and I've quit my job and started my own practice, I have realized how bad things were. So coming to InterX therapy 3 times a week seemed like a lot, and financially at some point we were like, this might not work, and we were able to make it work. To be honest, God provided in ways that we couldn't explain, and my schedule just worked perfectly with InterX. I actually used to work like 2 blocks from here, so it just aligned perfectly, and it was a God-given thing. Like, Janice actually recommended the cardiologist that I started seeing for my POTS treatment, and she had a protocol to deal with my condition because it's fairly new. There's not a lot you can do with it. It's just adjusting to your lifestyle and helping it get better. But basically, doing that therapy, my husband decided to start it as well. We bought a device so we would treat ourselves at home. I still did the treatment for 3 times a week, probably September to December. And then January on, I started maybe twice a week and 1 every other week. By January, I was off of all my medications. I was doing a lot of natural supplements, which are a lot better for you. You have nothing to lose, basically. So we went from traditional insurance, medical programs where you're like pain management and all that, which tend to be a lot cheaper at some point because you're only paying deductibles and copays, and that's it if you have really good insurance. But in the long run, they're just not great for you. And, you know, I wanted to get to a point where I could be healthy and maybe plan to have kids at some point. Because, if you are so horrible health-wise, you wouldn't really think of children, basically. And I remember my chiropractor making a joke about it. Between you and your husband, you shouldn't even try to have kids because your genes are just not great. And, it was a joke, but for someone who struggles with health issues and then developing chronic illnesses, you don't want to hear that. You don't want to hear that you're not going to get well, especially in your 30s. So InterX was a completely different approach. Your body healing naturally like it's supposed to. And actually finding a safe space where you could complain about your pain and struggles, and at the end of each session it felt like they were never there. You could feel no pain. Like for the first time ever, I remember Janice asking me, how much pain do you feel and where do you feel your pain? And it took me a few seconds to answer. I was like, I don't feel anything. I don't feel pain. And I didn't remember last time that I felt like that. So I started September. My husband started in January. From September to December, I just did InterX here in the office. January, my husband saw how great I was progressing. And his job, it was further from here, so he wanted to start it, but he was like struggling with that. So we found out that we could purchase the device using our FSA account. And basically during the enrollment period of the year before, we gonna prep that so we could actually pay for it. And in January we purchased one. He would use it more frequently because he was coming here less frequently. But probably I was coming here 3 times a week, and I would still use the device at least every other week because it really helped with the sleeping and the headaches and to release the stress of the day. He was probably using it daily at some point. It's just very easy to use. You're just lying in bed, and at one point I had a really bad flare-up, actually caused by my chiropractor. And I basically took the device with me to work. Like, even with clients talking like this, I would just hide the device in the back and kind of like be cool, and they knew about it. So it's just something that you can take with you everywhere. It's really easy to use. It's not as effective as coming here and having like 10 devices on you, but it would do the work to kind of follow up and treat yourself whenever you reach that pain level or uncomfortable. I recommend InterX to anyone I know, especially with the POTS and EDS conditions. There's multiple levels within those conditions, and thankfully mine is not as aggressive, but there's people that can barely get out of a chair, basically. And they use medication and they've done a lot of stuff, but nothing as InterX. So every chance I get, I'm in a lot of support groups in social media, every chance I get, I mention InterX to everyone. And a lot of people have the same reaction, well, it's expensive and I don't have that money. I'm like, trust me. Believe me when I say that it is worth every penny. It's an investment on your health, and you're not gonna feel the same after. It's just, you won't need as much medication, if any medication. You're gonna feel like yourself. So every chance I get, even with depression and anxiety, insomnia, stuff like that, I tell people, you've tried prescriptions, which should be our last resource, basically, because it's just chemicals and it's not part of your body. So why not try something that would help heal naturally? So I guess we are an InterX family. My husband does it as well. He has recommended it to a lot of his coworkers. So it's a no-brainer.
Awesome.